Hello, Mesa Public Schools employees. My name is Pete Lesser, and I'm the Assistant Superintendent of Human Resources for the district. On April 28, 2015, the Mesa Public Schools Governing Board approved several changes to the district's health benefits plan, which included an overall cost increase to the health benefits package, medical plan design changes, and increased monthly contributions from employees. I would like to take some time today to provide you with an overview of our health benefits plan and the changes employees will experience for the 2015-16 plan year. The presentation will include an explanation of benefits cost increases, medical plan design changes, medical plan comparisons, employee monthly medical plan costs, new programs that will be included in our benefits plan, benefits open enrollment, when it is and what will be required, and who to contact if you have questions about your health benefits. The items discussed in this presentation will go into effect for the new plan year starting on October 1st, 2015. Healthcare costs are increasing across the nation, and Mesa Public Schools is no exception. For several years, Mesa Public Schools was able to manage cost increases with little or no impact to employees. In 2012 and 2013, the district absorbed the increased claims costs and did not raise employee rates. Entering the 2014-15 plan year, the district passed on a 5% increase, even though the claims cost increase projected by our benefits consultant was 15%. Siegel, the consulting company that we use to analyze our claims, is projecting a 20% increase in benefits cost for this coming plan year. After a comprehensive analysis of our plans, the board approved changes that will be financially responsible and still provide a very competitive benefits package to our employees. The first change increases plan costs by 10%. Since employees have seen only small pay increases in the past few years, we explored ways to minimize the overall impact of this cost increase. Some of the plan cost increase will be offset by medical plan design changes that we will review in more detail. The final change increases the monthly contribution that employees make to their coverage through payroll deductions. For the OAP EPO plan, the employee contribution will increase from $40 to $60 per month. We will also institute a $10 per month payroll contribution for the two high-deductible health plans, resulting in cost increases that are distributed throughout all levels of coverage. Those enrolled in the prepaid dental plan will see a 5% premium increase, and the PPO dental and the vision plans will experience about a 10% cost increase. The district and employees contribute to the overall cost of our health benefits plan. For the 2015-16 plan year, the district will contribute about $32.5 million for employee benefits, while employees will contribute approximately $9 million. The changes made to the EPO OAP plan primarily impact the deductibles and copays. Approximately 60% of our employees are enrolled in this plan. This plan is the highest percentage of claims costs. The modifications to this plan still provide rich benefits, but also allow employees to share in the increased costs associated with this plan. The overall deductible will increase from $350 to $500. The copay for office visits to your primary care physician and specialists will increase by $5. The inpatient copay for hospitalizations will go from $150 to $250. The urgent care copay will be $50 rather than $35, and emergency room visits will have a $200 copay instead of a $100 copay. The retail prescription copay for Tier 2 drugs will increase by $10, but all other prescription copays will remain the same, as will the prescription deductible. Coinsurance, which is the amount you pay after your deductible and copays for certain services, will also remain the same. The out-of-pocket maximums will increase for this plan. The out-of-pocket maximum is the maximum amount that you will pay for deductibles, copays, and coinsurance in a plan year. There will also be some minor changes to the two high deductible plans. For the $1,500 high deductible plan, the deductible and coinsurance will remain the same. The only change to this plan will be in the out-of-pocket maximum. Please note, the out-of-pocket maximum is not the deductible. The out-of-pocket maximum is the maximum amount you could pay for expenses in a plan year. It includes your deductible and your coinsurance. So for this plan, the $1,500 deductible would be applied to the out-of-pocket maximum. Once you meet the deductible, you would continue to pay the 20% coinsurance until you reach the out-of-pocket maximum, at which time the plan would pay 100% of the cost. For the $2,500 high deductible plan, the deductible will remain the same. For the 2015-16 plan year, coinsurance will be added to this plan, and the out-of-pocket maximum will increase. Please note, the out-of-pocket maximum is not the deductible. The out-of-pocket maximum is the maximum amount you could pay for expenses in a plan year. It includes your deductible and your coinsurance. So for this plan, the $2,500 deductible would be applied to the out-of-pocket maximum. Once you meet the deductible, you would continue to pay the 10% coinsurance until you reach the out-of-pocket maximum, at which time the plan would pay 100% of the cost. Please note that the deductibles and out-of-pocket maximums are double for employees with dependent coverage. For this year, the district will continue to contribute to the health savings accounts for employees enrolled in the high deductible health plans. The HSA contribution will remain the same at $1,000 for the $1,500 high deductible plan and $1,500 for the $2,500 high deductible plan. I would now like to show you a comparison of how each medical plan will cover expenses with the plan design changes discussed. Meet Karen. Karen is enrolled in coverage for herself only. During 1 year, she has preventative care visits that cost $398, an emergency room visit that costs $2,600, 2 primary care visits that total $160, 3 specialist office visits that total $450, 12 generic prescriptions at $24 each for a total of $288, and 3 brand name prescriptions at $80 each for a total of $240. The total cost for these services is $4,136. Now let's take a look at how each of the medical plans would process these expenses and the employee costs associated with each plan. Notice there is no cost for preventative care on any plan. Preventative care is covered at 100% under all of our medical plans. Let's first look at the EPO plan. The ER visit will cost the employee $1,080. This amount includes the $500 deductible and the $200 emergency room copay and 20% coinsurance of $380. 2 primary care visits have a copay of $25 each for a total of $50. 3 specialist visits have a $40 copay for a total of $120. 12 generic prescriptions at a $7 copay each after meeting the $100 prescription deductible is $184. 3 brand name prescriptions at $25 each for a total of $75, and $60 per month payroll deduction times 12 months for a total of $720. For the $1,500 high deductible health plan, the ER visit meets the $1,500 deductible, and the employee pays 20% of the remaining $1,100 for a total employee cost of $1,720. Since the deductible has been met, the employee is responsible for 20% of the primary care visits, specialist visits, generic prescriptions, and brand name prescriptions. We then add in the $10 per month payroll deduction and deduct the $1,000 district contribution to the HSA. Employee costs on the $1,500 high deductible health plan total $1,067.60 for the year. For the $2,500 high deductible plan, the ER visit meets the $2,500 deductible, and the employee pays 10% of the remaining $100 for a total employee cost of $2,510. Since the deductible has now been met, the employee is responsible for 10% of the primary care visits, specialist visits, generic prescriptions, and brand name prescriptions. We then add in the $10 per month payroll deduction and deduct the $1,500 district HSA contribution, and employee costs in the $2,500 high deductible health plan total $1,243.80 for the year. For this employee, the $1,500 high deductible health plan had the lowest out-of-pocket costs. You can access the health plan costs for the 2015-16 plan year by visiting the benefits website at www.mpsaz.org/benefits. The 2015-16 monthly rates file will show a comparison of the monthly cost to full-time employees from current year to the new plan year for medical, dental, and vision. There are 3 new programs that we are adding to the medical coverage next year. The first is the Healthy Pregnancies, Healthy Babies program. This is a voluntary program that offers financial incentives to pregnant women if they follow certain guidelines that include prenatal education and postpartum screening. For childbirth, our plan will cover newborns only until the mother is released from the hospital, except when the baby is added as a covered dependent on our plan. The second is a cancer support program. This program provides outreach services and treatment support for both the employee and the family. The final is the Personal Health Solutions Plus program. This program ensures that employees and their dependents receive the most appropriate and cost-effective inpatient and outpatient care. One of the main differences will be that pre-certification will be required for certain outpatient services like outpatient surgery, speech therapy, MRIs, and CAT scans. In-network providers will automatically know to get the pre-certification. Employees using out-of-network providers must make certain this is done. The benefits open enrollment period will take place July 22nd through August 12th. All enrollments will be done using our online benefits enrollment system. This year, all benefits-eligible employees are required to log into the system to confirm benefit elections even if they are not currently enrolled and even if they are not making any changes. This is not like previous years, where you did not need to do anything if you were keeping your coverage the same. All benefits-eligible employees need to confirm their coverage. Even employees who are not enrolled in our medical coverage must log into the system and confirm that they do not want coverage. Confirmation of benefits is a new requirement of federal health care reform. Any election you make during the open enrollment period will go into effect on October 1st, 2015, which is the start of the new plan year. The Benefits Health Fair will take place on July 28th. It will likely be held in one of our high school gymnasiums, but the location has not yet been determined. You will receive enrollment and other information at your home address early to mid-July. Please be on the lookout for this information, and remember that all employees will need to log into the online system to confirm their elections this year. If you have questions about your benefits or any of the changes mentioned in this presentation, you may contact the Benefits Department at 480-472-7222. The benefits specialists are available to answer your questions and to assist you. If your last name begins with A through K, Michelle Bernal is your specialist. Lorraine Wagner will assist you if your last name begins with L through Z. You may also email the benefits specialists at benefits@mpsaz.org. The health plan rates for next year, this presentation, and additional benefits information are posted at www.mpsaz.org/benefits. MyCigna.com can be used as a resource to find physicians, obtain an explanation of benefits, track HSA balances and utilization, and find estimates on the costs of services. Thank you for your time and attention today. Please contact our benefits department if you have any questions.